And you know what? I think the health care plan actually may be dead on arrival, and we'll be getting to that. Thanks for calling. And yeah, dead on arrival. I said it. That is my fearless projection. And for the $1.5 trillion Obama health care plan, I say that not because of what the plan entails, and I think it's a bad plan, but because the latest poll results show some problems. They raise the critical question of whether Obama would be willing to stake his presidency on a sweeping overhaul that costs too much and has support that is way too little. Let's discuss it with Faiz Shakir, research director at the Center for American Progress and co-author of Howard Dean's Prescription for Real Health Care Reform, and Dan Gaynor, Vice President of the Media Research Center's Business on Media Institute. Gentlemen, an NBC Wall Street Journal poll released yesterday, it showed that only 11% of voters say health care costs are the #1 economic issue. Only 16% say health care should therefore be the government's top priority. And it gets worse. Only 33% say the Obama health plan is a good idea. 32% say it's a bad idea. So is the president's health care reform plan dead before it even hits the Hill? What do you think, guys?
Well, I would say I wish. But we've got several different plans, trillions of dollars spending. Just one bill, the bill in the Senate, 615 pages long, and hides a single-payer option. Obama's trying to do with this plan what he's tried to do, what he did with the stimulus, he's trying to do with banks. He's trying to ram his concept of transparency through faster than anybody can see.
Yep, and Faz, and if I mispronounce your name, I'm sorry.
No, you got it right.
Okay.
I mean, I think the more that people understand that the health care issue is an economic issue, the more they're going to support it. If you look at the polls, Gallup poll has a poll out that shows Obama and the Democrats are approved much more than the Republicans and the health insurance companies. So I think we're still in a good place. I think, we're in the middle of a legislative process, and you've heard this phrase that legislative process is a lot like sausage making. We're right in the middle where you're looking at this piece of sausage and you're saying, I would never put that in my mouth. That's gross, that's disgusting. But at the end of the day, you get a product that everyone's pretty comfortable with. And I think we're going to get there. But right now, we're right in the middle of it.
Okay, Dan, here's the thing, though. I mean, America is mesmerized by Obama. We listen to every word he says. The guy's on television 3, 4, 5 times a day. Dan, he's been telling us for months that fixing health care is the single biggest key to fixing the economy. And yet Americans, they put the economy and the deficit up way. 60% of people say in that poll that the deficit or the economy are priority one, and yet only like 11% say health care. They're not listening. What should Obama do?
Well, Obama's already, he's doing the full court press, and I mean press quite literally. He's got this ABC event coming up next week. The media that helped him get elected in the primary, helped him get elected in the general, and are pushing his policies now are helping him here. And ABC, it's just the latest horrific example. I mean, you wouldn't have seen something like this in the Bush administration when Bush pushed to reform Social Security. You didn't have that happen because the media didn't agree with the concept.
Yeah.
ABC's putting Tim Johnson out there, who's, their medical guy. He was pro-Hillary care in the 90s. He's 100% behind Obamacare now. They won't even let conservatives buy time on their network.
Faz, maybe Americans are ambivalent about the idea of trying to rein in health care costs. I mean, you know what? We think that health care is too expensive until someone we love is sick. And then we want to spend whatever it takes from whatever agency or our own wallet to save them.
No, that's absolutely right, and that's why the costs of healthcare system are so enormous right now. We don't invest enough in preventive care. But one point I want to go back to is what can Obama do? Well, I think one of the things is getting a lot of these businesses, both small and large businesses, automakers, involved in the process and telling the story about how much a public plan and a government-run system could actually help them. I think also looking at the bankruptcy statistics, you show that once you take a deeper look into a lot of these bankruptcies, you find that a lot of them are driven by the fact that enormous health care costs are eating up people's lives and forcing them into bankruptcy.
Dan, actually, I believe the latest figures show that 60% of the personal bankruptcies filed last year was driven by health care costs.
Yeah, but you look at the reason why companies are all signing on to this, and frankly a lot of other Obama plans, is because he's giving them the old classic mobster offer they can't refuse. They know that if they either play ball with him or they're going to be left on the bench when this all gets decided. Companies are, they're afraid of being left out and getting something even worse that happens to them. You're right about the American public being against this. In fact, the numbers are worse than when they tried to ram Hillary care down our throats in the 90s. The American public is less interested in health care now than they were then.
One quick point, I think, on businesses, the reason why they're supportive is not because of this mob mentality. It's because they see the global marketplace. They see that they're competing against Canada, the UK, a whole host, Japan, a whole host of countries who are offering health care packages from a government provider, and that we are not.
Okay, Faiz, but the problem here is Americans don't feel like it's a top priority. They don't want it to be, and only 33% of all of the voters, according to this poll, actually like the Obama plan and say it's a good idea. See, a president has to decide sometimes between doing what's right and doing what's necessary to get reelected. I mean, if you're Obama and you're evaluating this and look at these polls results, and I've been talking about this for 6 months, and now I've been unable to convince America how serious it is. Am I going to risk losing re-election and not being able to do more good for the American people, or am I going to give up and give in here?
No, well, I have a different reading of the polls than you do. I think he also campaigned on this. This was one of his top 2 or 3 issues that he went before the American public and said, elect me, I will do this. And I think he has an obligation to pursue that. I think it's possible that it can get done because of the political dynamic that exists.
You have an obligation to pursue it until you end up learning that your voters just don't like it, and then you need to get reelected. All right, Faiz and Dan, thanks very much for being here.
Thank you.
Take care, guys.
Thank you.